Most people these days know someone, whether in their family or a friend, who has cancer. A very common form of cancer would be leukemia. According to the American Cancer Society, about 43,000 people every year are diagnosed with cancer. And that age range goes from pediatrics, which are little kids, to geriatrics, which are older people. The survival rate depends on their gender, their age, and what stage the cancer is found. Leukemia is very common in children. A specific form of leukemia that is very common would be ALL, or would be acute lymphoblastic leukemia, which is the most common pediatric form of cancer. And since it's acute, that means that it is very fast progressing. ALL is a form of leukemia that starts in the bone marrow and it works its way out. It's very fast spreading, but it does not form any tumors, so it's hard to detect sometimes. There's no known preventions and there's no known risk factors. There are a couple that they have ideas that could be a risk factor, which would be treating other cancers like lymphoma, which is cancer of your lymph nodes, or radiation and chemo, getting those done for different viruses and other things. Also, people with transplanting organs, they have taken immune depressant, which can form a cancer, a leukemia cancer in their body. Also, the Epstein-Barr virus, which is a form of mono that your body will never get rid of, can develop and progress into a cancerous virus. The symptoms are extremely common with a lot of other colds and viruses. A lot of them would be fatigue, fever, weight loss, appetite loss, dizziness, weakness. Very common symptom with leukemia would be easily bruising or bleeding of the gums or nose that don't tend to stop. The only way to get a true diagnosis would be a CBC, which is a complete blood count, and if your white blood cell count is extremely high, they will then go and do a bone biopsy and they will test that for the cancer. Depending on the type of cancer and the stage, some symptoms can cause a swollen belly from all of your white blood cells pooling in your stomach, and bone and joint pain, and then enlarged lymph nodes, especially across your clavicle and in your auxiliary region and your groin. Treatments may vary depending on, again, your gender, age, and the stage of cancer. A very common type would be chemotherapy. Target therapy is used sometimes, but it's extremely hard with leukemia because it targets certain cells, and sometimes leukemia can be multiple cells at a time and they can be in different systems of the body. The survival rate is 8 out of 10 that reach remission, which is not a cure. That's just where it is dormant. It's not an active form of cancer. But most of those people that reach remission are going to relapse and come out. The overall cure rate is about 35%. Normally with patients that have reached remission, they will continue to treat them 2 to 3 years after they have reached remission, just to make sure that it doesn't come back, but most of the time it will come back. Leukemia is a extremely common and sometimes overlooked form of cancer, and there's a lot of clinical trials. I know that Johns Hopkins has about 10 different clinical trials for childhood leukemia, where they are researching, spending millions of dollars every year trying to find a cure or some form of medicine to help. A very common type of medicine that will help is called Gleevec, which a lot of even geriatric and med-surg, which is like about 20 years old and up, they will use the Gleevec, which is still a trial. Only about 10,000 people have reached remission using it. My father currently is in remission from leukemia using the Gleevec. They still are producing more and more types of chemotherapy, trying to find a cure for it, and there are multiple clinical trials. Okay, that last minute, I literally pulled out of my